All right.
All right, I'm Dr. Tony, Crooked Spine Show, Brianna Cardenas.
Thank you.
David, our video, tea guy, everything guy in the background.
Thank you. Handsome assistant.
Do your thing. I set some things up. You'd sent me your profile and also what we want to talk about today. I want to start with, and this is going to be a show about chronic pain and how we manage it correctly so we get better results for our patients, me as a chiropractor, you as a physician assistant too in the medical field. I want to start with, why do you get into this in the first place? I want some background information, Brianna.
Okay, so I am an athletic trainer and physician assistant. I'm also a patient that deals with chronic pain. I have a condition called Ehlers-Danlos syndrome. It's a connective tissue disorder.
Okay.
It makes me extra bendy, so you can see I'm super bendy. I can bend my whole hand like backwards.
Okay, that's a benefit.
So at first it was great. I was super active, an athlete, and I actually got into sports medicine because I was an athlete. I played softball competitively from a young age. And kept getting hurt all the time.
Like, what is going on?
Right. I had 2 surgeries on my shoulder by the time I was 20. I had knee surgery at 18. And just had, chronic pain as a result of those
just
injuries.
Keep going more and more. This is not normal.
Right, especially not for, a young person. And so I dealt with chronic pain. I had been just given an opioid prescription, and I was actually on Norco for 2 or 3 years all through college.
Was this? Through college, okay.
Yeah, so this was when I was 18. So from pretty much 18 to 20 was dealing with chronic pain that I think is a very common experience for young women. I just got totally blown off at the doctor. I complained of, back pain, hip pain, and it was just, oh, your x-rays are normal, it's totally fine.
This is normal for someone your age dealing with this all the time.
Right. Wow. So it was a bit disappointing, and I didn't really have access to complementary and alternative therapies like a great physical therapist or a chiropractor at that time.
There's no need because you said your doctor said this, so this is all you can do, and you're kind of just pigeonholed in that one area.
Right, and I trusted my doctor, so I just, went with their recommendation and unfortunately continued to suffer with pain. When I was 20, I was doing my physical therapy rotation as an athletic training major. Okay. And he recognized, hey, I can pull your hips out of place. I can pull your shoulders out of place. I was 20 at that age. Okay. And he said, this is not normal.
Wait a second here.
Right, and so he said, I think you have a connective tissue disorder.
He's a physical therapist.
Right, so it can't be diagnosed on physical exam alone, but the type that I have, because there's 13 different variants, actually a 14th one as of late, but it's the most common kind. It's the hypermobile Ehlers-Danlos syndrome. So that's
the most common kind?
That is the most common. It affects, so we think, up to 80% of people with the condition. However, 80% of the people that have this disease won't ever get their diagnosis. They will live their entire lives without any type of understanding. I think it's under-recognized by a lot of physicians and a lot of, I think a lot of the medical model that we have set up doesn't really allow for people to spend a lot of time with their patients because it presents in all different ways. Usually the joint instability is one, but until it becomes a really severe problem and until someone has a physician or healthcare provider that can listen to them and really put all those pieces together, it's kind of just what's called a zebra or something. That's considered a rare medical condition. So we have a saying in medical education that says, when you hear hoofbeats, don't think zebras, think horses. And so this is meant to say that common things are common. So if someone comes with a cold, don't assume that they have some rare,
crazy airborne disease, something like that.
Right. It's probably the more common thing. But the mascot for the Ehlers-Danlos Society is actually a zebra. And a group of zebras is called a dazzle. So we dazzled together, and I knew that I needed to use my background in sports medicine to be able to help people on a larger scale. So I moved into the physician assistant program.
Give me 1 second, check this real quick. I'm getting the live feed to drop off. That's posture. Maybe click more. I'm gonna make sure it's going well. Sometimes the feed's not picking up. Okay. I don't know why it says interrupted. Still says live.
Sorry.
That's okay. Let's go for it. Okay. With what we're doing now too, and it hopefully comes back in a second, a lot is going to be is like your syndrome too. How do doctors screen for things like that out and go, okay, let's try this, this, and this, versus no, let's just do this one thing?
I think
why is that so common?
I think it's more common to have kind of a preset goal on the side of the clinician or healthcare provider, based on the medical model that a lot of healthcare providers are kind of pigeonholed into now. So a question that I get a lot is, why does it take so long at the doctor? It takes an hour and a half just to get in and see them, and then I only have 15 minutes with my healthcare provider. So how can I possibly get that in? And they were staring at their computer the whole time. They weren't even looking at me. They weren't listening to me. And that's because reimbursement from insurance has been cut dramatically. So the insurance payers who give, X amount of dollars to your doctor to see you, now it's about half of what it was back in the early 2000s or even the late 90s. So whereas a private practice doctor could get by and keep their doors open and pay their staff with maybe 15 patients per day, which leaves you about a half hour per patient. Now it's a scenario where you need to see 30 or 40 patients a day just to keep your doors open. And unfortunately, that lends to shorter clinic times. And really the incentive is for efficiency rather than the fact that there's a human being sitting in front of you that's asking for your help.
Why is it an hour wait, though?
So the wait comes from the fact that I don't think that you can really give good health care in 15 minutes. And myself and the doctor I work for, his name's Dr. Jinsep Kim, and we're at Mission Medical in Colton. We make it a point to give our patients the care that they need and the time that they need. And sometimes that means that, it might run out of that 15-minute window. But what we kind of think as a clinic is, if you give a patient that extra time right off the bat, and show that A, you care about the human sitting across from you, and B, we're getting to the root of what's wrong with the patient, not just, here's a pill to take it away or to cover it up for you. Really finding out what's wrong with the patient may take a little bit extra time to do a thorough exam, watch someone walk, watch someone, how they lean over and how they twist, and are they stiff or are they sitting off to one side like this? Those are really big indicators that if you're not looking at your patient and paying attention to them because you're documenting or trying to get your notes in, you're not going to see.
Well, it's more common to lose that personal relationship with your doctor now because they are on the computer all the time. You only have 15 minutes. You can't really get to know someone that period of time.
Right.
If you had a chronic problem long term. So by you doing your clinic your way, even though it may not be as efficient from a business perspective or insurance recovery, a reimbursement perspective, or income for the practice, you're gaining that trust with your patients, going, hey, look, I'm here for you.
Right.
I want to be your doctor in the sense where I want you to trust me that I can give you the best treatment based on our time together today.
Agreed. And that's the kind of care that I would want. I mean, I've been in the scenario where I've been totally dismissed by doctors where, they just, 2 minutes into talking to me, it seems like they already have their idea of how they're going to treat me, rather than asking me, hey, what are your goals? What are the things that you want to be able to accomplish? And are they realistic? So I understand that with the connective tissue disorder, I'm probably not going to go play competitive softball again. But if I can get to the point where I can get through my day, do my activities of daily living, like, make a meal or be able to drive comfortably, those are the quality of life measures that I'm after. And I don't think that, it necessarily requires a ton of injections or pills to get to that point.
Well, take a step back too. It seems like, because I'm not in the medical field, more in the chiropractic healthcare field, is commonly someone's going to come in and go, like you said, in 2 minutes, I have the pill for you. I have the drug for you to help with your pain, versus you're looking to go, how do I make this person quality of life? Might be some medication, might be some therapy, but what's your, like you said, what's your goal? Again, not to be the Olympics, but what do you want your quality of life to be, say, 5 weeks from now, 5 years from now, 10 years from now?
Correct. And I think that understanding both the short and long-term goals really helps a provider evolve a treatment plan with their patient to kind of meet those goals both in the long and short term. So a lot of my patients express an interest in trying to reduce their opioid consumption or their reliance on pain medications.
Great.
But there's a lot of times where life happens. And a lot of patients with chronic pain do need these medications, and it's not the same as as someone who has a substance abuse disorder or someone who has an addiction problem. So the majority of the patients that we see are using their meds appropriately and trying to take them as sparingly as possible.
But it's because you're actually talking to them and going, okay, maybe use it here, but not here.
Right.
So you're actually guiding them versus what I see in my office, people in my office, my patients, they've been on medication for sometimes months and years.
Right.
And they've never been told really how to use it.
Right.
When is it appropriate? Because they're maybe a person who has a desk job, someone who has construction work. They're not a doctor, so they almost have to be trained and educated what's a good way to use your medication.
Agreed. And I think that it depends on the patient's occupation.
Mm-hmm.
So we have patients who are iron workers or
That's
firefighters.
433, baby. I see a lot of...
Okay, yeah, and they just go, they beat up their bodies, they work hard for their income and their livelihood. And I'm not going to put someone on a prescription drug that is going to be 50 feet up in the air and have impaired consciousness or, mental clarity. Whereas someone who maybe is in their 90s, or rather 80s, because 90-year-olds, ideally would not be on a ton of medications. But somebody who's already homebound, somebody who is a paraplegic, somebody with a spinal cord injury, their kind of needs are going to be a lot different than someone who's still working.
But again, you go back to listening to what they do, how they work, how much pain they're in, what type of career they're in, how much mental aptitude they need while they're working, even physical aptitude, so you don't make them at risk when they're on medications to cause another problem or another injury for themselves or someone else around them.
Right, and I think that's why it's so important to give people that patient education, because there are so many other ways to manage pain other than pills and other than having to go into your doctor's office. So there are things where you can go to physical therapy, you can go to a chiropractor, and sometimes those are even barriers because if people are, living paycheck to paycheck or people don't have that disposable income, there's no reason that they can't stay healthy if their provider teaches them how to stretch, how to do a morning routine to get their bodies limber, how to pay attention to their biomechanics and how they walk, the shoes that they wear, even everything from how they're standing when they're cooking or how they're standing during those activities of daily living. Small adjustments in posture or in, muscle stability or strength can lead to really some long-term gains over time, but they do take time, and that's why in the short term medications can be an effective tool, but they're really not meant for a long-term management of these
Why
disorders.
do doctors do that and put patients on long-term management with medications?
I think that's difficult to answer because it varies for every doctor. So I think
my patients ask me, that's why.
Right.
And I go, I'm not a medical doctor, I don't know, so I'm here to talk for your judgment or personal opinion.
I think sometimes it might be a scenario where, unfortunately, it might be the easier thing for that physician to do or that healthcare provider to do. If they're feeling the time crunch, if they are, they need to see a certain amount of patients to get their staff paid, which isn't an excuse because ultimately the patient is the person that suffers. But if I were to say kind of with a paintbrush, like why are people so rushed and why don't healthcare providers in general spend as much time with patients as they need to, it's because they feel that they can't. And so sometimes it just becomes easier, unfortunately, for just a refill versus, hey, let's talk about some of the underlying factors that are causing you to have this pain, and also addressing other issues like the psychosocial component of what pain chronically does to people. It causes a significant amount of depression and isolation. There may be underlying, abuse at home that we don't know. Maybe other conditions that are really down at the root of some of the issues that people are presenting with that manifest as physical pain or get worse with an injury than we would expect. But that takes a lot of time and that takes a lot of trust. And if that relationship is not established with patients because there's not that initial time spent off the get-go, you're never going to get to those underlying things. People aren't going to let you in to say, hey.
You're talking about really overall, how do we connect with our patients to make sure they can open up to us to tell us the root problem of what's causing them to take medications or the effect of medications for a long term, so sometimes to make their lifestyle, their quality of life, their family life almost seem at a lower level than they actually want.
Right.
I've had patients come in to where They've been taking medication, one lady last year for 10 years. Chronic pain medications, divorced, not leaving the house, depending on their child to bring food home. Their depression was at a 1 to 10 level, a 10 pain scale from 1 to. So what you're talking about is how do we make our care as healthcare professionals more professional, more respectful to the patient, to find out what they really need, not just pill after pill after pill, or in my sense, an adjustment after adjustment, so their overall lifestyle improves by what they're doing outside our office.
Right. I think ultimately just taking it on a case-by-case basis, and as healthcare professionals, just really getting, right down to the reason why we got into this in the first place.
Huge.
It becomes so easy to just be buried in charts and, oh my gosh, I have 40 patients on my schedule today. But when we start looking at it as like tasks that we have to complete and like a burden that we have to do before we can get home, it's very easy for some to slip into the frustration of feeling like it's the patient's fault. And then conversely, I'm a big believer that you get back what you put out in the world.
Of course.
And so if you're rushed, if you're not engaged, if you're not giving the patients the quality of care that they deserve, they're going to know it. They can tell when you're not looking them in the face, when you're looking at your computer.
They're people just like us.
Exactly.
They are sometimes more intelligent. They have more intuition, what to look for your personality going as a mirror image. Are they really listening? Can I trust them with what I'm saying? Mm-hmm. Are they going to give me the right care?
Right.
And sometimes you may not gel with a patient, but when you give an honest opinion, hey, I'm here for you, I want to help you, you give them the time. I was thinking about it right now. Being a psychologist, psychiatrist, they're locked into an hour.
Right.
They have the time with a patient or a client going, I'm going to listen to you, what's going on, you're going to feed back and forth. That's a time we may not need an hour, but can we spend enough time with them to find out the root cause of why they're there?
Right, I think so, and I think it may take, a couple of visits, but I also encourage my patients to keep looking for a healthcare provider until you find one that you feel comfortable with. So,
and with your clinic, do you take insurances?
We do. We take private, we take PPO insurance, we take workman's comp insurance, and we take Medicare as well.
Fantastic.
So, and I really can honestly say that my doctor is one of the kindest people that I've ever met.
Well, if anything, he's mentored you also to have a good sense of how do we make our patients comfortable, build trust with them, and so they let us know how we can help them and give them the right care. So catch-22, they come back healthier. They feel better. Their quality of life improves.
Right, and a lot of my colleagues, especially in chronic care, where you're going to be seeing patients month after month after month, the idea of giving a patient, 30 or 40 minutes at their slotted 15 minutes is like something that I've literally gotten scoffed at. Like, you're going to put your clinic behind. What about your lunch?
You're
going to
go bankrupt.
Right. But I put to my colleagues and I put to, patients in general is that, if you are well taken care of at your first 2-3 visits, or if you're in a crisis scenario and you need that 30 minutes, I think that it's going to resolve, or at least as a patient, I know that the extra time that my doctors have given me goes a heck of a lot further to allow me to have the resources and the trust in my physician. So that way when, he's slammed, he's got a line of patients and I've been waiting an hour and I just need maybe a refill of medication or a referral or, some type of imaging done, I can go in and say, hey, I know that you're really busy. I just need an MRI. I need this. I need that based on our existing treatment plan. Yep. And then it's a quicker visit. Yeah. So it's actually easier to manage patients if you guys have a common game plan that you're working toward, if there's a common goal in mind, if there's an outcome that you both are working toward and that you've established real actionable tasks for those patients. So if you tell a patient, like, oh, just make sure you get up and stretch every day, well, what does that mean? Yeah. Last time I got up and stretched, I hurt my back.
I saw a Jane Fonda video 30 years ago.
Right.
And should I do that, or what do I do?
Right, exactly. And so evaluating the patients, really looking at a full biomechanics screen. And if you don't have the time, that's why it's important to do stuff like we're doing right now.
Exactly.
Find your local healthcare professionals that share similar viewpoints, that share similar patient treatment philosophies, and that you trust. I send people to my physical therapist all the time. I send people to my neurosurgeon. I send people to the doctor that I work for, because I feel that when you can really create more of a community feel and a team of healthcare professionals that as a patient you feel have your back, you're more likely to get the resources that you need and the true instruction that you need. And you're more likely to follow that game plan because you've got people that are counting on you. And I think that's a big step with chronic pain, is just feeling like you've got people that care about you.
But I think sometimes too, as a patient, from a patient's perspective, sometimes they do want to come in for a quick fix. They want, okay, what can I take? What can I do right now so I can go back to work? This is a Friday, back to work on a Monday. Or back to work tomorrow because I take a day off of work today. And so when patients have that mentality, I want a quick fix, I want to feel better this and get back to work this afternoon, tomorrow, and do my normal thing. How do you get a patient to switch that mentality, go, hey, you have a problem that may take 3, 4, 5 weeks to heal completely, you may need a couple weeks off of work. How do you change that mentality?
I think by just doing exactly what you said, just being honest with them and saying, hey, your condition is not one that's going to be, easily remedied or that's going to be cured with a medication. It's going to take work on the patient's part. And it may be something where they're like, hey, my daughter's wedding is this weekend.
And I got to be able to walk down the aisle, got to be able to do this.
Exactly. And in those scenarios, that's when, the use of medication or the use of going to the chiropractor or the use of doing some of those more interventional things like an injection. So I have patients who will get, an epidural, or they get a trigger point injection because, I'm going to be driving for 6 hours and I don't want to be with my shoulders up here. I need something right now. And that's where we really should be stepping in as healthcare providers to alleviate that. But I think our role too is to counsel our patients that, hey, this quick fix is just that. It's a quick fix. It's not going to be long-lasting. It's not going to yield long-term results. And so by counseling the patient that, yes, this may help you for the weekend, but it's not going to fix your underlying problem, and we got to stick to our long-term plan in order to keep working those steps to get you there. And I think also just having realistic expectations set with the patients.
And I think a lot of it is when you have expectations and you set up, okay, it's going to be a visit to get you started, but we're going to have to see you here, here, and here to realize this is a process. You have to change what's broken down in your body, fix that over time, because it didn't happen just today. It didn't happen this morning. It happened over a period of weeks, maybe even months and years. How do we reverse that? Taking some time to realize what it is. How do we find out what it is? And then from there, give yourself a chance to heal. Not just feel better, but to heal. So you maintain that, and like you mentioned too with the habits, how do you learn certain stretches to do? Then from there, strength exercises also, so you can maintain your body's health, tolerate the stress you want to go through every day with your work, with your family, with your husband, with your kids, with your students if you're a teacher, whatever it might be. So you can understand, like you had mentioned, spending the time with them, what their overall stresses are in their life, and make sure they understand we need to do this so that becomes easier. Long-term and short-term.
And that's really, there's no easy way around that. There's no 15 minutes that I could get to know any human being in that capacity. I look at healthcare as relationships that I'm building with people. And I really sincerely care about my patients. I know my doctor does too, and that's why I work for him.
That's amazing.
It's unfortunately a more and more rare thing to find these days. But people like us exist. There's healthcare providers that do really still care about what they're doing and aren't, maybe just jaded because they've got 2 years to retirement and they're almost done, or whatever the scenario is. So that's why I think really on the patient standpoint, what they can do to serve them best long term is initially just, even if you've gone through 5 doctors that don't seem like they're listening to you, keep looking for the one that you feel has your best interest in mind, because that's ultimately going to be how you establish a good foundation upon which you can build those goals.
I read something a while back, I listened to something to where people will plan their vacation for next summer anywhere from 2 to 4 hours a day, maybe a week long. Where to get the reservations, where hotels to stay, what's a good reviews. My wife loves reviews. I go, let's go to San Diego, we'll find something there. My wife wants to spend 3 hours on the computer calling people, reviews, which is good for her.
That's a great point.
And the details. But why don't we spend the time looking for doctors now, before we're sick, that have the same philosophy as us, as I want to get better, I want to stay better, I don't want to be on medication the rest of my life, but I have to do the homework now to get there.
Well, I think that that's, kind of a two-part question. So I think that from the standpoint of like why some people aren't able to find that care is an access issue. Because if you have an insurance, like I have HMO insurance.
So do I.
And so for me to go, like I'm not even allowed to see my doctor as a private patient because my insurance won't allow it. So I have to either see him cash or I have to go out to Cedars-Sinai where I have, the majority of my care. And that is after I saw 2 in-network specialists that had to certify that I did need advanced care at a tertiary care facility like Cedars-Sinai. So it took me 6 months to even be able to get an appointment with the doctor that I researched and I sought out. So even with a physician assistant degree and knowing how to navigate this system, it's very difficult because insurance is put in place to kind of make it so that every doctor gets like an even share of patients, so to speak.
Socialized.
Essentially.
Medicine somewhat.
To some degree, right?
Yeah.
But at least with other socialized healthcare platforms like Medicare, you can go see whoever you want.
I love Medicare.
So they get to see
whichever
wait. Doctor. Right, I know.
Can't wait till I get 65.
Silver lining.
I'm going to get fake ID so I can be 65. That'd be awesome. And like you said, it took 6 months to see you get the care you needed. Why do, and what upsets me and angers me sometimes, people have to wait so long to get the care they need. Now their condition went from being a 1 or 2 in the pain scale to a 4, 5, or 6.
Absolutely.
Where now their lifestyle has gone so far down, they have to climb out of that hole.
Right, and I think that that's, a major problem with our healthcare system in general. And I think that that's why it's important to have educational resources like what we're doing right now, just getting awareness out there, letting people know what their options are, letting people know that you don't need a referral to go walk into your office or to walk into a massage type of establishment, or in some cases physical therapists will take what's called a direct referral, where you just say, hey, you know what, there's a great chiropractor at Casa Colina, for example. Yes. They don't cover my insurance, but I've got the $60 per session to pay. Can you just write it on a script? And they'll take that. So there are ways around it. As a health savings account. Agreed. Right. Okay. But it's kind of difficult because then that even requires people to have expendable income, and people who aren't working, people who are on disability, that can be a real challenge for them to even be able to see the doctor. They might know the specialist that they want to see, yes. But they might be on the other side of the country with a disease like mine. Like there's very few specialists in the country even specialize in this disorder or have even heard of it. And I'm lucky that one of the world specialists is at Cedars-Sinai, because the other one for spinal fluid leaks, which is the main issue that I suffer with, is in Stanford. There's one at Duke, and
you have to travel.
Right.
It's a lucky bird. You live locally. You've been here forever, and this is your home. Right. And what I worry about too is some patients will come in. I have good insurance. Yes, you have health insurance, but your copay is higher than my cash paying patients.
Right. So just better to come cash at that point.
And like I said, doing your homework and go, okay, where do I want to go? Who accepts my insurance? So I know where to go if and when myself or my family member has a problem.
Right.
And that may change year to year, but I have to do my own homework.
Right. Agreed.
I want to know where to go, and I can trust that person or those doctors or physician assistants or chiropractors understand they're for my best interest.
Right.
They can treat me like they would their own family members that they actually like.
Mm-hmm. Right. I know.
Somebody don't like
the second uncle twice removed or something.
Exactly. And that's the thing. And going and kind of wrapping this up a little bit on our first show, because we'll have more down the line as you get famous, is what's a good starting point, 3 or 4 things for people to look at when we're looking at, okay, I want to find a primary care doctor in my best interest. I'm on some medications now. I want to eventually get off, but I don't know what to do. What's the best way to look at, what's the first step to take? First, second, third step.
I'd say first, if you have your diagnosis already, because they're kind of 2 separate paths. So if you already know what's wrong with you, if you say, I have Ehlers-Danlos syndrome, or more commonly, I have, disc herniations in my lumbar spine.
Whatever it might be.
Okay. Go online. There's a great website called Inspire.
We'll put that in on the show notes too.
Awesome. So get involved with social media. So if you just hashtag your illness, hashtag Ehlers-Danlos
Inspire.com hashtag?
So hashtag is on the other social medias, but Inspire.com is a website for rare disease patients to come together on a forum. So people with like cystic fibrosis or Ehlers-Danlos syndrome or spinal fluid leaks can find the resources that they need and knowledgeable healthcare providers in their specific area that have specialty in that type of treatment.
How about for chronic pain? Is there a website or somewhere to go to directory?
There's quite a few. So I think if you have a good understanding of what your actual condition is, and stratify it by, you know, perhaps that condition or body part, you'll be able to find a specialist more easily online. And use online reviews, because I sincerely believe that people get the reviews that they deserve. And I've worked at places where it's maybe, you know, a 1 or a 2 star, and people feel that way for a reason, you know. So it's,
I've used Health Grades before as a way to research doctors. Is there another site to use that's pretty credible?
I think there's not really a good credible one for a lot of physicians and other healthcare providers at this point. But the other thing that you can do is by word of mouth. Find another patient who yes, exactly. Yeah. Another patient who has what you have, or put it out on social media if you're comfortable. I mean, I've relied on social media, and I've made some amazing contacts. I found my neurosurgeon via social media, who has given me some quality of life back, you know. So social media, I think, can be a very powerful thing. And just keep advocating for yourself would be the third thing.
And be, I don't want to say aggressive, but you have to be out there, because it's about you taking care of you.
Right.
No one else in charge of you unless it's only you.
Right. And I think as females, sometimes it's hard to stand up to a physician. Yes. But I think the way that I think about it is, if someone was dismissing my husband, my mom, my dad, my brother, and my good example, my brother had testicular cancer, and they were just brushing off his pain as, you know, oh, maybe it's, you know, a kidney stone, or maybe it's this, or maybe it's that.
No, I know what it is.
Right, and I was his advocate, because I'm not going to let my family suffer. And if we look at ourselves as, hey, we're sometimes the glue that holds our families together. Moms,
they come to you.
Right, and so the same, you know, emphasis that you would place on advocating for a loved one, do that for yourself. Don't be afraid to, you know, respectfully say, hey, you know what, can you put your laptop down? I feel like you're not paying attention to me right now, and this is really important. That can go a long ways and kind of be the snap back to reality that some clinicians...
The patient wants me to listen to them.
Right, right. And if they're not willing to give you that time, then that's not the doctor for you.
And realize, even with your health insurance, if you have HMO like we do, or Kaiser, whatever it is too, and maybe not a PPO, somebody's in PPO too, you can still go to different doctors. You're not going to be told, as far as I know, you only can go to one doctor, that's it. Insurance covers what doctor, and that's it.
Right.
You have options. Instead of looking at reviews is step one, asking your friends, family, whatever it might be, going to social media. Those are ways to find out doctors you want now in your contact list, so when you do need them, or if you need them right now, you can go to them and go, hey, I want to check them out and see.
Right.
That's key.
Like, assemble a team, your healthcare team, because the same way you would do it with any other type of thing in your life. If you need like your vacation reviews, you're going to have, you know, a travel agent, or you're going to get your hotel, your car, your plane, all of these different things.
Exactly.
You're
Restaurants, you got to eat.
Right, yeah.
You know?
Think of it like a game plan for the most important thing, which is your health. You know?
Huge. Anything else to end our first show?
I just want to say thanks for having me. It's been great.
And that's because on the show notes we had to take a quick break because of connection issues. I'm going to make a YouTube video out of this too. We're going to put it together. Awesome. I'm going to put all of Brianna's information on there too. Your new website you put on there too. Twitter, Instagram, Facebook. We got a Facebook page lined up in the future. But the biggest thing is making sure you have resources so you don't have to be on pain medication your whole life. You can be told by one doctor what to do, and that's it. Find someone like Brianna and her doctor, Dr. Kim, she works with, put the clinic's information to if that's okay with you, and go for a consultation. I don't care if it costs $100. $100 is less for me than going on medication, taking days off of work, not spending time with my family, and not being able to live a quality life. We spend money on things on things that don't really matter. This is the day and age of we have a lot of resources and sometimes a lot of wealth. Use that in the right way. I've done videos, people that do out-of-pocket breast examinations for screening for breast cancer, because it's more quality, higher, less false positives for 1, 2. You get quality care. If you can afford it, if it's practical for you, sometimes a budget may seem unmanageable. Realize we need to worry about our health care, not someone else's, and get the right care right away. Gives you the chance to get the best care to get out of the situation, back to a normal health lifestyle. At that point, learn, like Brianna does too with her patients, how to stay there, how to maintain a lifestyle so you don't stay naive, you learn how to do it and apply those habits over time. All right. Anything else for first show?
That's it.
Good. Thank you for coming and put everything out there, and we'll put the replay on YouTube and also bring information too. All right. Thanks for watching. So overall, what did we talk about?
We discussed ways to access the healthcare system with your particular condition, ways to manage chronic pain, ways to advocate for yourself in order to feel like you've been best heard at your doctor's office in your appointment.
And also to finding a doctor that you can trust, even a physician's assistant or a chiropractor. Also, spend the time and energy like you would shopping for a vacation home or going somewhere with your family. Give yourself the time to find resources that you're comfortable with. It may take 3 or 4 doctors to find the right one. Be patient. At that point, when you need a doctor or a chiropractor or whoever does the healthcare field, you can find one that's best is for you. Also, time-wise, you talked about time. Go ahead real quick.
We talked about why it takes so long to get into your doctor at the clinic and why sometimes it feels like there's such a short amount of time spent with patients these days.